Dr. Snow, what's the role of payers to try to sort of bring this to populations? I mean, obviously, the clinicians that we have around the table and around the country will deliver the programs, but thinking about the populations that you cover and getting the word out that it is covered and trying to have those populations take advantage of these programs.
Sure. I mean, we would love to see these types of programs being taken advantage of, being utilized. Clearly, there's the health benefits for members, the cost benefits, both for members and for the payer, and just in general, a healthier world, which is one of our goals. We know from past experience that even when there is solid coverage, such as for diabetes education for folks with diabetes, that many folks do not take advantage of this, either because the patient doesn't take advantage of the benefit or physicians don't refer. And regardless of why it doesn't occur, and that's to the detriment of our members. Mm-hmm. So fortunately, diabetes is one of those items that plays a significant role in quality metrics and measuring quality programs and contracts that exist because of quality care that's being provided. So there's an incentive for physicians to be making sure that their members, that their patients are getting the care that they should for our members, and hopefully we will be able to facilitate getting the word out there that this is a covered benefit, right, and that folks should take advantage of it.
So the real secret sauce is how to get people to sign up and show up. Once you get them to the program, we can almost predict for the 1,000 people, 10,000 people going through what's going to happen. But how do you get the right person to the right program at the right time, to engage them, to activate them, to get them to see that there is a benefit from that program? That's the secret sauce that we're all trying to
really identify what it is that either identifies a patient who is likely to be engaged. Right. If you offer them, they're the one who will show up, or what is the behavior that, whether it's the payer or the provider, what's the behavior that they can add to take somebody who is less engaged and turn them into somebody who is.
Exactly.
Sure. You know, and that's where I think another piece that, I know we started to talk about a little bit is offering different modalities. So in-person things are going to work well, going to the Y are going to work well for certain people, but digital solutions are going to work well for another group of people. And so tailoring the approach and engagement to what a patient would be most likely to do.
Perfect segue, because earlier we talked about technology, and I want to get into different modalities, different types of coaches, educators, different types of technology, digital technology, a lot of different ways in which these prevention programs can be delivered. Could somebody talk about?
I would love to jump in here. I've got some notes in front of me, so if you don't mind, I'm looking down. But I have two sons who are in the millennial generation. And if you don't deliver messages to them on the smartphone or online, the message gets lost, especially when we talked about younger populations. And so the digital platforms, I think that will be, especially for younger people, is online, of course, through the computer for diabetes prevention, and smartphone apps, text messaging on smartphones, interactive voice response on telephones, and telephone conference calls and emails. So there's like 6 great digital platforms, especially to address that younger population who relies on digital to enroll in programs, get their messages, know about behavior change. I think it's critical.
What about other populations? Does that work for the Medicare population or for those who are older?
Yeah, it certainly does. I think we have to distinguish between 2 kinds of digital approaches. One that I would call tools, and the other interventions. So a text message to remind you to do something, it's a tool. An intervention says there's a beginning, a middle, perhaps an end. There's a theory behind it. There's been proven evidence that it works. There's a coherent set of activities, a protocol, curriculum, et cetera. And tools enable people to do things, but in most cases, it's the people who are ready to do it anyway. An intervention has to be designed so that it can take someone who's thinking about it, overcome their barriers, get them to become active, and have them do the things that they want and need to do to improve their health. So yes, those tools are important, but if they're not in the context of an intervention that's been thought through, my prediction is they will only work for those who don't really need it as much.
Mm-hmm. Yeah. I would think in terms of the interventions, there are things like behavior change, but also on the tool side, it's sharing data as well, right? Collecting information and being able to share that. Also, Bob, from your perspective as a clinician, with patients who might participate in these programs. Do these help you to?
Absolutely. One of the things I like to do with my patients is ask them if they have a smartphone and do they carry it with them all the time. And depending on what they have, I say, it's actually, how much do you walk? And they say, oh, I walk a lot. And I'm like, do you mind? Can we check to see on your phone? It probably tracks how much you're walking. And typically they're very surprised that they're walking far less than they thought. And I say, well, here's a goal. What do you think you can do? And so that's a very simple example of a common digital tool that is pretty ubiquitous that can be very effective. Now that, as Neal says, is only a tool, and really if you want to do something to prevent diabetes, you need a whole intervention based on not only counting steps, but also dietary changes and other behavior change approaches.
Mm-hmm. And also in the population, it's very easy to accept that the millennial population, the millennial age, lives and dies by technology. But that does not mean that older folks aren't very accepting of technology. Absolutely. And for particularly folks in the Medicare population where getting to their physician may be a real challenge. Because of other health issues or transportation issues. So in that population, it may be even more important than in the millennial population where it's the process that they like, but they have alternatives that an older population may not.
Because it can be telephone. So, I have
right.
a 97-year-old mother who wouldn't know a computer from a dishwasher, right? But she knows how to use the telephone. And that's part of the digital platforming.
That's right.